Thanks for joining us for the news at 10. I'm Doug Petcash. More on sports coming up later, but now a look at the latest state COVID-19 data. As of Friday, Health and Welfare is reporting 870 new coronavirus cases. The backlog of positive tests is slowly shrinking. There are about 3,000 test results still pending local health district review. Hospitalizations have also slowly declined. Statewide, there are 136 people in Idaho hospitals with COVID-19 and only 30 patients in ICUs. Unfortunately, 5 more Idahoans died from the virus. The percentage of COVID tests coming back positive is down in a big way to 3.7%. That's down from the Omicron surge peak of 38% last month. Since the start of the pandemic, the state has reported nearly 438,000 cases and more than 4,800 Idahoans have died of COVID-related illness. Today, March 13th, marks the second anniversary of COVID in Idaho. On this date in 2020, the state reported our first 2 cases. You can see how far we've come since then. Our Katya Stepovic joins me now. And Katya, you caught up with a couple of Idaho experts about this situation, the 2-year anniversary. What did they have to say?
Well, first of all, Doug, between you and I and everyone watching, it's so mind-boggling. We were talking about this to think that we've truly been in this for 2 years since the first 2 confirmed positive COVID-19 cases here in Idaho. And you yesterday spoke with Dr. Christine Hahn, state epidemiologist, on this morning's Viewpoint. I also caught up with Dr. David Peterman from Primary Health CEO, who remembers getting these first positive test results firsthand. And they both say we have come a long way to where we got today.
We didn't know how deadly it was. We didn't know how it was spread. And when we began to hear some of that information, then, yeah, we were worried.
Little did any of us know that in 2 years, Idaho would lose almost 5,000 people to the virus, with hospitals overflowing, staff members getting sick, and crisis standards of care enacted twice. It seemed like there was no end in sight until...
Where we are today is tremendous relief. And I would describe it as almost remarkable.
Case counts and positivity rates have taken a deep dive, leaving us all with a much-needed sigh of relief.
I'm hopeful that we are now coming to where we can talk about this mostly in the past.
As COVID restrictions lift left and right, experts begin to see the future of COVID-19 in a less intimidating light compared to 2 years ago.
We're hopeful that we now have the tools to deal with this. Between vaccines and understanding when and if we might need to mask and socially distance versus when we can, when we don't need to do that. We have more and more antiviral treatments available now at pharmacies. We also have the monoclonal antibody treatments more available throughout the state.
So what does it mean, endemic?
Simplest way to think about endemic is that it's here to stay and that it lives here. Just like we know that every year we're going to be seeing influenza, we'll continue to see RSV, we'll continue to see other diseases.
It does appear that we're going to stay at, quote, a low level of COVID. And the hope would be that more people get vaccinated, it's a low level, and we won't see the variants. I do feel that this is different. Maybe it's hopeful thinking. I've been through 5 surges with COVID. I have never, with the other surges, seen anything like we've seen the last 3 to 4 weeks, where it has just dropped.
So what do experts hope you learned from the pandemic?
I hope we begin to think beyond ourselves, beyond just our own families, but we think of those we don't know. Because with coronavirus, what we learned is we're not just wearing a mask to protect ourselves or our own family, but it's to protect those that we don't know.
That's absolutely right. And again, this downward trend in COVID cases has medical experts optimistic that this will hopefully, maybe someday, become more of a seasonal virus.
And, Katya, in talking with Dr. Hahn, she said we could get to a point where it's a yearly shot with for COVID, recommended, just like with the flu shot right now. How does Dr. Peterman see that?
Yeah, well, Dr. Peterman says, like much of this pandemic, like most of the pandemic, it's really hard to predict, right? So we'll have to see what happens with the pandemic, and in that, what vaccines become in high demand. But I think the bottom line that he wants to stress tonight is that we are more suited and better suited to take on whatever comes our way with these antiviral treatments, monoclonal antibodies, than we were 2 years ago.
Yeah, and moving forward, Dr. Hahn also said that she feels pretty comfortable with people going out and about,
She did.
doing what they want to do without masks, unless they still feel more comfortable wearing one.
Yeah.
So we have made a lot of progress.
Long time coming.
Lost a lot along the way, though,
Yeah,
too.
absolutely.
Thanks, Katya.